Today we will discuss ear examination steps according to short case. So when the examiner asks you to examine the right ear, you start with greeting and then you will introduce yourself, ask name and take consent and make proper exposure and position of the patient, as these are the mandatory steps in every examination. Next, as you all know, start with the inspection of the ear. Inspect pinna, external auditory canal, preauricular and postauricular region. These are all the mandatory parts which needs to be inspected. And then have a look on the other side, and after that you will start with palpation. Palpate the pinna, palpate tragus, palpate preauricular and postauricular region. Next step is inspection with speculum. Hold a speculum in one hand and hold probe in other hand, so that if there is any discharge you can probe the discharge and then smell it. The next step is otoscopy with Valsalva. You need to do otoscopy in both ear. And the important step is that change speculum for each ear. Do not use same speculum for both ear. So next is whisper test. Next, do tuning fork test, in which you will do the Raynaud's test, Weber test, and absolute bone conduction. So next step is examination of the facial nerve. You will examine the facial nerve by checking the facial expression. Also do anterior rhinoscopy and posterior rhinoscopy to see the nose and nasopharynx if there is any mass in the nose or nasopharynx. Next, examine the ocular movement. Examine the corneal reflex and trigeminal sensation. Check the cerebellar sign. In the short case, check only two cerebellar signs. And the next step is neck lymph nodes. Palpate the neck for any lymph nodes. And final steps are gait and Romberg test. And in the last you will do fistula test, because fistula test can induce vertigo, so the patient can be disturbed by fistula test. So this is the last step in the ear examination, and then redrape the patient and say thanks. So these are the main steps in the examination of ear, whether there is any mucosal disease or any squamosal disease. So I will also show you how will you describe otoscopy findings in a case of cholesteatoma. There can be a small attic perforation with whitish mass. There can be attic ear perforation with erosion, and whitish mass is seen in the attic region. There can be attic retraction. There can be granulations, and there can be posterior marginal perforation. These all can be findings of a cholesteatoma. And in the mucosal disease, perforation in pars tensa is present, which is usually a central perforation or a subtotal perforation. And you will comment on the perforation. You will comment on its size, its the quadrants which involve this perforation, the margins or edges of the perforation, whether they are epithelialized or non epithelialized. And you will comment on ossicles and middle ear mucosa, whether it is normal or edematous. So these are all the steps in the ear examination.